Human Rights Watch says it's concerned about a water crisis in Zimbabwe. The international body says it has the potential to exacerbate the health risks of the COVID-19 pandemic. According to the NGO, over 2 million people in the capital, Harare, don't have access to safe drinking water or adequate waste and wastewater disposal services. Human Rights Watch Southern Africa Director Deba Mavinga speaks to us now. Very good morning to you, Deba. Tell us more about the situation that Zimbabweans are finding themselves in.
Well, Zimbabwe is under a national lockdown, and in the capital, Harare, and surrounding cities, there is a severe shortage of water and sanitation services, and this has complicated the responses and compliance with lockdown measures. We know that people require clean, sufficient water for them to be in a position to maintain personal hygiene standards that are required to combat COVID-19. Also, thousands of families are now forced to have to go to boreholes to queue for water and to use the same borehole in overcrowding conditions, which make it impossible to comply with social distancing requirements. And so this is why Human Rights Watch is really calling on the government of Zimbabwe and the city councils to provide sufficient water, including ensuring that there are, water points across the cities and across the country to ensure that people do not overcrowd and are in a position to practice social distancing.
Yeah, I mean, incredible that some people have to wait up to 9 hours to get any sort of water. How has the government responded to your calls, and what in reality are they capable of doing in this time?
Well, it's a huge challenge, which was there even before the onset of the outbreak of COVID-19, and the government has been slow in reacting to provide water to residents. We know that also in Harare and Chitungwiza, residents have had to take the government to court to have an order to compel them to provide water services. And I think one of the important things would be to declare this crisis and open up and ask for international assistance if there are no resources sufficient for this response. One of the problems has been that the security forces in Zimbabwe, the police and the army, have been heavy-handed in their enforcement of the lockdown and have not adequately addressed the issue that the people need to have access to water, and also to help the communities with ensuring social distancing and also ensuring sufficient water points. This has not happened, and it needs to happen urgently if the national lockdown is to be successful.
And I should imagine, because of those security concerns, that people are frightened to speak out and express their demands and fears. But what are they telling you about how they're feeling and what it is that they're experiencing?
Well, the people are saying clearly that they are caught between a rock and a hard place. They're saying whichever way they are facing death, either because of starvation and use of unsafe water or lack of access to water, and also because of the use of force by the security forces for them to keep indoors when they desperately need to have access to water. So the people of Harare, Chitungwiza, are desperate for water and are appealing for help, and they believe that the government is not thought through and properly planned the lockdown in a way that ensures that they still have an uninterrupted supply of water.
What sort of impact is this having on the spread of the coronavirus? And does Zimbabwe, and I ask this knowing that they don't have adequate facilities to deal with it, health facilities?
Well, Zimbabwe does not at all have adequate health facilities and health personnel to deal with the COVID crisis. And now it seems that it is spreading. And we now have reports of 23 confirmed cases in the country. But you should also know that there has been very low testing capacity for Zimbabwe, less than 550 tests have been conducted. So the picture is not clear in terms of the rate of the spread, but what is really concerning is that even for the health workers, they do not have adequate protective personal equipment to use, and there have been complaints as well, and health workers have also had to take the government to court to insist that there be sufficient protective equipment and also a rollout of mass testing to ensure that health workers and public hospitals are adequately equipped and prepared to fight COVID-19.
With autocratic governments, I mean, there's always a concern, or they are always worried about any sort of outside influence inside the country. What sort of response do you think you'll get from the international community to step in whatever way they can to alleviate the problem here?
Well, I think what's important, and our appeal to the government of Zimbabwe, is that really you cannot respond to a public crisis through propaganda. There is need to be open and truthful about the extent of the challenges. And one of the problems seems to be that repeatedly the government of Zimbabwe has taken a gung-ho approach and has said, we are ready, we are prepared, and we have the resources. This is not helpful. There is need to open up and declare the extent of the challenges and to say to the international community, please help us in these particular ways. And of course, we know that there have been some support, including the donation of testing kits, protective equipment, but there is need for more for Zimbabwe to scale up its testing capacity and to have the capacity to trace contacts and ensure that they really know the levels of infections that have taken place in the country.
Speaking to us from Cambridge, Dewa Mavinga, thank you very much.